Hello. Hello. Good evening, everyone. My name is Ryan Rosario. I am the host of Michigan Asian Live, where every 2 weeks we have a show, and our show is about Michigan Asian Americans here in the state of Michigan. And our show is based on your story is our story. Tonight, we want to discuss a very important matter for tonight's show. Tonight's show is our Asian leaders discussing live tonight COVID-19 facts and stigma impacting the Thai, Hmong, and Laos community in Michigan. We have our highly respected panelists who share their insights, concerns, and science-based solutions of stopping the spread. Hold on a second. Hello, everyone. Hello, everyone. We had a little internet mix up this recently, but anyway, let's start all over again. Welcome, everyone, to Michigan Asian Live, and with our panelists
Hi.
on screen. Say hi, everyone.
Hello. สวัสดี
Hi.
Hi. Thank, first of all, we want to thank you. We want to thank you for everyone joining us tonight. And tonight we have a very important thing we want to discuss today. Tonight, our subject is a very important matter. And our subject for tonight is regarding about our Asian leaders I have here tonight. We're going to be discussing live tonight COVID-19 facts and stigma impacting the Thai, Laos, and Hmong community here in Michigan. Our highly respected panelists will share their insights, concerns, and science-based solutions of stopping spread in the high-risk areas. And here's the best part. Since we are covering our different communities, tonight we have a special treat where we are going to speak in the Thai, Hmong, Laos language this evening for all our viewers here. But before we get started, I have to interview. I have to introduce our wonderful panelists this evening. We'll start with Dr. Mayuvree Wadhawam. Dr. Wadhawam has been in the United States for the past 38 years, and she has worked for the Thai government for 10 years. Before, she also done educational video and television programs, and her last significant thing before retiring was to put together a 5-year master plan to establish a new educational television station for Channel 11. Now, she is also a honorary member of advisory group for the Midwest Buddhist Meditation Center, the MBMC, and also a vice president of the Thai American Association in Michigan. Dr. Mayuri earned her doctorate degree in education from the University of Massachusetts Amherst in 1985. She has 2 daughters, one in emergency medicine physician and other engineer. And her husband is still working at GM and is an IT specialist. Dr. Mayuvree Wadhawam, welcome to our show.
Thank you.
Our next panelist, we have Dr. Sue McKeithen-Polish. And Dr. McKeithen-Polish is a MISD bilingual education title consultant. She's also for the Macomb Intermediate School District. She works with students of diverse background from kindergarten to 12. She's an adjunct professor at Wayne State University. She's also been recognized for leadership in education and cultural diversity work. She's also the Council of Asian Pacific American Education Chair and board member. With that, she also is the Michigan Asian Pacific American Affairs Commissioner and the past president of the Thai American Association of Michigan. Welcome, Dr. Su.
Thank you.
Our next panelist is Ms. Nan Najarian. She is the current president of the Thai American Association of Michigan. She manages management of a restaurant of a Thai and Italian restaurant in Brighton, Michigan. She graduated from business major from Ramkhamhaeng University of Thailand. Let me make sure I pronounced that correctly. Received certification from beauty professional. Received certification from Ubon Vocational Professional. Taught school in Uman, Thailand, and an active community leader. Welcome, Nan, to our show.
Thank you.
Our next guest, we have Annie Viengrouthasane. Born in Thailand in 1999, where she immigrated from. And in 1991, 7 of her family members moved to Detroit, Michigan, the Motown city. Went to middle school. Also has been 15 years as a massage therapist, 20 years of an interpreter and translator in the Lao and the Thai languages, 29 years of volunteer in Laos community, and 8 years of Lao International Dance Interaction, and very active in the local community. Welcome, Annie, tonight. And last but not least, we have Kor Xiong. Kor has been in the U.S. for 30 years. She's married and has 4 beautiful children. She is a registered nurse and working at Bowman Hospital for 14 years. Kor also leads her language expertise and works part-time as an interpreter for the Macomb Intermediate School District bilingual education programs. She lives in Warren for the last 20 years. Kor, welcome to our show tonight.
Thank you.
Thank you. Well, tonight, before we get started, I want to extend my wonderful thanks to all our panelists this evening for joining us to talk about a very important subject. And that subject is what I've seen across is recently some hard numbers.
Did we lose Ryan?
And tonight, before we get started, I want some stats. I just looked onto the internet. As of right now, according to the reports that I've seen, the total number of coronavirus cases globally is 22,525,000, and the total deaths of 789,127. That is globally the current number that we encounter. And in the U.S. That we're experiencing, we've had a total of 5,694 cases. And even just today, we had cases up to 38,000. It seems like it's not changing a lot. And with a total number of total deaths of 176,158. Those are the numbers we want to start this evening to see how bad this pandemic has started. So before we get going, I want to introduce Dr. Sue Polish, and she will be our narrative for this evening to set up our outline for our discussion. So Dr. Sue, first of all, I have a question for you before we get started. Share a little bit about the format. We're going to ask some few questions, and you're going to answer a few bit of that. And also the best part is we're able to speak and discuss it in the specific language in correct?
Correct. So I will lead with just the English portion of it, and the rest will be spoken in Thai, in Lao, and in Hmong. So our goal is to relay the information and really stress the importance of all the information and of the experience that we've seen in terms of COVID-19, and share that with our community members, given that our community members, they do keep up with the updates and all of that. However, we still feel that there is an issue within our communities in terms of how much information that is correct or how much safety they are following. And we are quite concerned and want our community members to have all the information and to get up to date what we have, so that way they can practice safety and really making sure that their family members are safe.
So before we start, let's start with a first question I have, right? Dr. Sue, how is COVID-19? How does it spread?
Well, according to the CDC resources that I've keep up to date with, is to person. Basically, when you are not doing a couple of things like social distancing, or I call it physical distancing of 6 feet, that in itself, in our community, I'm just referring back to our community, we may not be aware of that too much. And so we tend to congregate and we want to get close and talk to each other because that's the way we communicate. That's how we socialize. So it passes to person. And when we don't keep the social distancing, it can really be an issue. And then, of course, wearing a mask will help also, because when you are speaking, the droplets, the airborne of the particles of the disease that goes in the air, if you are not wearing a mask or if you are standing way too close to each other, that's how it spreads. But and another thing is the hygiene, the washing of hands, using hand sanitizer if you can wash your hands. So the bottom line is that it is passing person to person. When you cough, when you speak, when you are way too close to each other, that can spread because it is airborne. Would you like our panelists to also share that in their language, Ryan? So that way they can share that information with their community members. And I will ask Dr. Mayuvree and also Ms. Nan to share that information in Thai, so that way, our community members know that it is spread person to person, and that the social distancing and wearing masks and things is very important, because the particles of the disease is airborne when we cough, when we talk. Dr. May or Dr. Mayuvree? I refer to her as Dr. May, easier.
Oh, sorry. We since we have two Thais on this
พูด
program.
ภาษาไทยค่ะ เพราะว่าอยากจะให้ทุกคน
เดี๋ยว
เข้า
ก่อน
ใจ
นะคะพูดภาษาอังกฤษให้ Brian เข้าใจก่อนฮะ
ค่ะ
like Brian to understand the first part is going to be คุณแนนคุณแนนพูด first part แล้วก็ตอนหลังตอนใกล้ๆท้ายๆแล้วก็ I'll at the end I'll be the one who take over. So at the beginning, don't have to cut it to me, cut it to Kun Nan.
Okay.
Until we start talking about going to the hospital. Thank you.
All right, then we'll refer this to Kun Nan, so
Kun
she
Nan,
will
yes.
go ahead and okay. So is Kun Nan here?
Awesome. Dr. Sue,
If not, I can
continue on with the next set of things that we want to cover that's very important. Go ahead.
Oh, okay. Do you want me to translate, or do you want to go ahead and cover the next important part? I can. So what I'm trying to do is that I'm giving Kun Nan, our president of the Thai Association, a chance to speak. But at this point, I don't see her coming
She's
on.
there.
Okay, she is. All right.
She's there.
พี่แนนคะช่วยบอกด้วยนะคะว่าการที่ติดต่อนั้นมันติดต่อทางไหนได้นะคะ
โอเคค่ะอันนี้เป็นข้อมูลเกี่ยวกับ Covid-19 ที่ได้มาจากCDC Resources โอเคแล้วก็ Covid-19 แพร่กระจายได้อย่างไรใช่ไหมคะพวกเราเชื่อกันว่า Covid-19 เนี่ยแพร่กระจายโดยการสัมผัสอยู่ใกล้กันนะคะแล้วก็บางคนอาจจะมีอาการหรือไม่มีอาการบางคนอาจจะไม่มีอาการแต่ว่าสามารถแพร่เชื้อไวรัสให้กับคนอื่นได้นะคะอันนี้คือคนต่อคนที่อยู่ใกล้ชิดกันและสำหรับความรุนแรงหรือว่าการอาการนั้นจะขึ้นอยู่กับแต่ละบุคคลส่วนการแพร่กระจายแบบบุคคลต่อบุคคลเช่นว่าระหว่างการสัมผัสใกล้ชิดกันใช่ไหมคะอยู่ใกล้กันมันก็สามารถติดต่อกันได้แล้วก็ในระยะห่างพวกเราควรจะอยู่ห่างกันระหว่างประมาณ6 ฟุตใช่ไหมคะเสร็จแล้วทีนี้เกี่ยวกับละอองการหายใจผู้ที่อยู่ใกล้กันอาจจะไอหรือจามใช่ไหมคะตรงนั้นถ้าเราไปสัมผัสก็อาจจะหายใจเข้าไปในปอดหรือว่าไปสัมผัสกับละอองน้ำลายหรือว่าที่ไอจามอยู่ในบริเวณนั้นก็อาจจะติดต่อกันได้
ค่ะมีอะไรอีกไหมคะที่จะหรือว่าเดี๋ยวให้น้องแอนนี่เขาพูดต่อในภาษาลาวเลยนะคะ
ได้ค่ะน้องนี่ต่อเลยค่ะ
ค่ะ thank you ค่ะพี่แนน now I'd like Annie to say the same or to add or anything you want to add in terms of how it spreads person to person in Laos please Annie ไม่ได้ยินค่ะ Annie ไม่ได้ยิน
สบายดีขน้อยสื่อแอนนี่เนาะอยากจะมาหาข้อมูลแล้วก็เพื่อเผยแพร่ให้พี่น้องได้ฟังการแพร่กระจายของโควิด -19 ที่สหรัฐอเมริกานี่ก็ประมาณสูงสุดก็ประมาณ 5,600 แล้วก็ผู้ติดเชื้อก็ยังnumber ก็ยังขึ้นอยู่และที่นี่เฮาอยากจะมาให้ความหัวมือหรือว่าความรู้เนาะจากเรื่องโควิด -19 ว่าเฮาจะได้ป้องกันแนวใดแล้วก็โดยสำคัญสุดก็แม่นว่าจุดประสงค์ก็คือว่าการเผยแพร่โควิด -19 นี่มีทางใดแน่เนาะ1ก็จะมาจากคนสู่คนเนาะจากการหายใจจากการทางเดินหายใจหรือละอองฝุ่นที่ว่าเฮาเว้ากันแล้วก็ใกล้กันจนเกินไปจนละอองฝุ่นที่ว่าเฮาเว้าออกมานี่เป็นอากาศแล้วก็กระจายออกไปแล้วก็จะนำคนสู่คนเนาะอีกอย่างนึงก็คือการอาการที่ว่าเป็นอาการหลายๆแบบคล้ายๆกันกับไข้หวัดใหญ่แล้วก็บางคนก็จะบ่มีรสหรือกลิ่นทางการสัมผัสเนาะและเฮาก็จะอยากจะมาให้พ่อแม่พี่น้องได้ฟังและก็ได้มาเข้าใจในข้อมูลเกี่ยวกับโควิด -19 นี่เพื่อป้องกันให้พ่อแม่พี่น้องของเฮาลูกหลานของเฮาและผู้สูงอายุที่ว่าได้เผชิญกันเนาะหรือว่าเฮานี่ทาง community ของเฮานี่ได้สูญเสียคนที่ฮักไปแต่เฮาอยากจะบ่อยากจะให้มันเป็นเฮาอยากจะป้องกันก่อนจะมันที่จะเป็นเนาะนี่ก็อยากขอให้ Brian ที่ว่าเพิ่นเป็นThe Asian media ที่ว่ามื้อนี้มา communicate กับเฮาชาวลาวอยู่ทั่วหน้ากันใน YouTube เนาะขอบใจ
Thank you, Annie. And now I'd like Kor to come and share in Hmong, please. how this is spread person to person, and or anything else that you would like to add on to.
Hi, thank you for Michigan Asians Live invite me to this show to talk about the COVID-19 regarding to how it's impacted Hmong people and how the COVID spread in the community. Nhớ trong cú lông bè hoa có trong của lọ cộng lời Michigan Live thả cho bé cho COVID trong nó spread đi cha từ đi cha tống tờ lời thử sĩ lòng tờ CDC là do cái nó cá hậu hồ tờ cái cháu sủa phía tàu hải tiệt cho COVID-19 nó New York kỳ từ mỏ trong đi cha cho COVID-19 nó nếu muốn tàu giả ý do nữ kỳ lòng tờ ý tu nâng trâu ý tu nâng vì đó khó thổi ý tư năng nữ nhỏ jelly trâu phi ok nữ nhỏ mua bằng sự kỳ tàu vì đó khó hạt tiệt ý tư năng của bà có mua bằng sự của tàu lại cho bà đời nữ nhỏ một nhỏ đó họ có luôn trừ rồi chỉ cá mó đó họ thế chỉ ta lên tới thầu cho nên có nhỏ rèn tới nữ nòng nữ tê con dâu là tê bàn đời rồi thiệt thế nữ nhỏ làm một bóng trong đời có tê dây mua tê khoản dâu khoản chư có yo một có tê khoản dâu khoản chư có yo kỳ tàu tụ cá mó nọ nữ nhỏ đó có mó tàu tụ cá mó nọ yo ít tụ cá mó và nữ kỳ dùng gì hẹn lì xử lý kỳ tàu lần đời qua ba là yo ít lần chữ ít lần thế chỉ ta lên đời nhỏ xí rề giờ lên tới cho các món nào nữ cứ muốn gì và dùng li cho các món khâu thua thảo lúa chay bé hùa influenza nếu muốn gì ở trong lên tới thì nữ có từ chức bự nữ cho các món nữ kỳ là muốn gì ở trong lên tới nữ cứ yo luôn trong ý ạ li cho món con nữ kỳ trời li cho bà và có uổng được tụi mình tới có nhón ra ít tụi mình lên tới trâu phi thì có nhón rể trâu lợ lên tới cậu chỉ là thì đỡ có sản phẩm một bằng sự do kỳ tàu tụ cá món đỡ do lên đỡ lấy thiết li cho nên hậu CDC lấy cho nên qua món thiết li tàu cho chạy cái tàu kia rồi bé cho nên số lên số tụ để bé chủ chẳng pha bé chủ nhỏ để lên đỡ trâu phi đỡ ít nên tư thiết bé chủ tàu bỏ bé cho hành châu giờ cho các món nào thầu nữ món tàu dạ spray tàu ya do nữ kỳ lon tờ ý lăng ý tu và nữ một có ý giả khổng tư ya thầu tu nâng đỡ nữ một chữ ý giả khổng lợ ấy có họ một có ná ấy tu nâng đỡ nữ mó nữ họ một có ná chỉ có một có tàu chỉ có là một có cái khẩn do khổng mua tên nó có yếu mó thế nữ cu yếu kỳ tàu rồi có tu cá mó nó ya ý tu cá mó và nữ yếu một trò ý tu nâng dùng gì hành lì giờ lên tới bé thì li tàu kia thế cho CDC thì tàu kia tàu bé trồng hử mong sợ đời thế cho xua từ ninh nhớ hậu luôn địa tế nó hay tiệt bé giờ chủ ở đây cha bé thì li tì thái tàu tụ cá mò nó bé giờ chủ rùa tề thế bé giờ chủ rùa bé cho tề li xâm bù thế nó thế bé giờ chủ tàu xí hand sanitizer thế bây giờ chủ sĩ đã alcohol xia chát năng够xia chát到9%的老门子啊，要头那期末的样的了那个是 alcohol 领导人做到，这其他领导要点头个头中了个主导是 mask， แล้วยังต้องบอกหันเจ้าหลังบอกก็ลูกหันเจ้าลูกหอบเพียงเดอยาวิดอกหอก็ย้อนเชดหรือลังหรือตูเนื้อเนื้อไตปลาแต่เขาย่องเดเนื้อก็ยองกูจีเตาเนื้อกูอยู่chẳng chỉ tao hay tiệt có yếu chỉ tao để xin nữ ba hay tiệt có chỉ cho kỳ tao dùng gì giờ liên tới thầu có qua ba có thể là chỉ qua ba đồ lưỡi lăng lưỡi tù theo thầu con nòng có chó con chó này thì chỉ theo một đồ lưỡi lăng lưỡi tù giờ liên tới là thì là chẳng tổng hay tiệt có bé số lăng số tù yếu chủ cho đóng bọc hàng giao lúc xí hơi có tới trong giờ hai tiệt thầu có mó tụ các mó nào là nè hay ở ô trà thế chỉ ta lên tới giờ tụ các mó nào tụ cho sớm cần thế nữa tụ chưa bự hơi rong đi trà cho các mó nào nữa mua trời lì có yếu nòng có yếu mó ít chè thế có yếu mó chả đá tên nó thế có yếu nó mó chỉ cá theo nó con kềnh thế ô nó có chỉ mua giò thế có lú chè trong cổ lưng thứ mó con tàu giờ thầu có bó hay tiệt có tàu tụ cá mó COVID-19 nó lợi có yêu chủ đi trả thế có yêu tỷ thái đi trả nếu cũng mua ó giả rồi có yêu tỷ thái giả ý do có chỉ mó hẹn do có món mẹ mẹ xứ giờ có vô chủ sai chùa có từ khen nhá hậu ba hậu chế có thấy chùa có từ khen nhá hậu ba hậu chế có vô chủ tàu hậu đê nó mỏ có rong theo có vô chủ tàu chứ có từ khen thế kia có từ khen theo cái vô chủ tàu nhỏ ý hóng trở lý có từ khen xứ có vô chủ chỉ cho muốn đo lưỡi lăng lưỡi tù có vô chủ nhỏ hậu cái chủ có mua hóng rùn đó là hóng chán đó vô chủ mua chỉ thấy đã đây tên nó là cái chủ nó có ý linh theo có cho nhon rồi có chế ninh có nhớ hậu lợi dân bá tàu có theo lợi dân thế kia tàu có ta chỉ lợi nhớ chỉ bu cha cầu chỉ là thì thầu lúc sẽ hở là lò thế kia có thầu lúc là sẽ hở là sai chùa có lợi chủ tàu long ná long tên chúa tên theo lợi chủ tàu cho mass thế thầu lợi tàu món tàu bọc hình châu lợi cho dễ tên nó có tên bùa trái nhá hậu có hông hậu ấy cho con châu tên hậu tên bà hậu chỉ xong cả là cho con luôn chế mua theo có tên hình châu còn chứ mình cho lử tù thì đi chỉ kỳ tàu giờ linh tới giờ thì thằng ó giờ thầu có linh tới tàu ấy có chỉ nó trong hình ná ấy có món rượu tua li có qua chỉ tàu bà or có món xía tên nó là giờ có lúc lỡ chỉ mua rau tên nó có mua chọc hoặc cho gì tên nó ấy có bảo hay để có lúc chỉ mua rau hết chỉ khó giàu là có tàu muốn chỉ cho doctor có tàu muốn về hospital còn là bác có li là mua oxygen đó có là mua cho bác có là giờ là mua đây cho đó có thế là cứ mua antibiotic tên nó là bác có dùng rượu cú bảo hay để bây giờ này chỉ mong sợ đời giờ thầu nên mua tàu tụ cá mắc Covid-19 nó là nên cũng mua cái tụ share thế cái chăm mua nên cũng xài nhưng xài những ý giả cá mắc nó chỉ xài lăng từ đó cá mắc Covid nó nhưng trâu số lăng số tụ để chỉ của hai đó bây giờ này chỉ mong sợ đời hay tiệt nên giờ chủ chẳng phải nên tụ khen protect nên tụ khen thiết sai số nàyจะมีตู้มีหยวกก็จองอันนี้นอกอยู่จุก่อจองเที่ยนี่อยู่จุตัวเขาได้แต่นอก่อนนี่มั่วจ่อแต่นอเอ็นยาเท่านี้จุเตาเลยแต่นี่อยู่จุมุนจีนหมอกแต่นอเอลที่ป้าเตาเน่ยังในมอด้าจีนนู่นแล้วยังหูตองหมูตัวจะหังหมอกแล้วยังมั่วเป็นสื่อป้าเตาเลยยังนี่หมูเขาออนไลน์อันนี้หมูคอแล้วหัว CDC informations แล้วยังมั่วจะ information เขา provide ตัวนี้แต่ลูกกูหายนอยังยอดไปยังอีสื่อหายรอเลยไปแต่ก็หายดัวซื้อยังนี่มั่วหลวงได้จีละนี่กูนู่กูละกูเตาอีอยากเที่ยว่าจังเตา
Thank you, Kor. It sounds like you cover everything for us already. That's wonderful. So I'm going to refer back to Ryan. Ryan, do you want to continue the question, or would you like our Thai or Lao lady to talk about what happens when, when they are catching or when they are having COVID? What are the next steps and all of that? So I'll leave it up to you how you want to.
Well, I think what we should do, again, thank you again, ladies, for explaining that. And what I'd like to do, again, let's talk about the next step of our tonight's show. And how do we go about some important question that we already covered so many things, but what are the steps, like you said, to help prevent the spread of COVID-19 if you are now sick and you have the disease, to protect yourself and to protect your family? So, Dr. Sue, I'll let you ask our panelists and introduce them on different parts of this.
So, Kun Nan or even Dr. May, I think Dr. May said she will talk about when you need to go to the hospital. So let me refer to you the same questions, because what happened, when you have it, when do we know that we go to, to the emergency room or contact emergency room? What do we need to do? Watch the symptoms or what? So I am going to ask Dr. May to, to explain that in Thai to our communities. What are some of the steps of prevention, or even if you're sick, what do you need to do after that? Dr. May?
Okay. All right. สวัสดีค่ะก่อนอื่นก็ขอขอบคุณดร.สุนะคะที่มอดเรตรายการนี้ก็ถ้าสมมติว่าเราเป็นรู้ว่าเราติดโรคโควิดเนี่ยคะถ้าเราไม่รู้ว่าเรา positive คืออาการของเราเนี่ยจะมีอาการหายใจไม่ค่อยสะดวกแล้วก็จะแน่นหน้าอกนะคะแล้วก็มีความสับสนมากเลยแล้วก็เดี๋ยวก็จะมีความง่วงนอนนะคะง่วงนอนแล้วก็ ปากมันจะแบบเขียวนะคะถึงเวลาแล้วที่เราจะต้องโทรหาคุณหมอนะโทรหาหมอประจำตัวก่อนถ้าหมอประจำตัวไม่สะดวกนะคะก็ให้โทรหา911อาจจะให้ ambulance มารับไปหรือว่าให้ครอบครัวไปส่งที่โรงพยาบาลในการที่จะก่อนที่จะไปเนี่ยคะขอให้โทรศัพท์บอกเขาก่อนว่าเราสงสัยว่าเราจะเป็นโควิดนะคะเขาจะได้เตรียมตัวเตรียมสถานที่ให้แล้วก็ถ้าสมมุติว่าเราติดต่อหมอเราไม่ได้เลยเนี่ยนะคะก่อนที่จะไปเนี่ยก็ปรึกษากันให้ดีว่าจะทำอย่างไรนะคะทีนี้พอเราเป็นแล้วเนี่ยเราเป็นแล้วเราเข้าโรงพยาบาลแล้วนะคะเรากลับออกมาเนี่ยเราก็ต้องพยายามที่จะรักษาตัวในการที่ว่าใส่แมสเป็นประจำนะคะรักษาความสะอาดล้างมือนะคะแล้วอย่าออกไปไหนและส่วนท่านที่ยังไม่ทราบที่ไปเทสแล้วนะคะแล้วปรากฏว่าตัวเองเนี่ยเป็นติดเชื้อนะคะก็ไม่ต้องไปคือมีคนเข้าใจผิดว่าจะต้อง14จะต้องกักตัวนะคะถ้าเรายังไม่มีอาการเนี่ยเราไม่ต้องกักตัวเราเองแต่เราที่จะต้องอยู่ห่างคนอื่นไปไหนมาไหนก็ต้องใส่แมสนะคะใส่หน้ากากแล้วก็อยู่ distance นะคะไม่ทราบจะให้พูดเรื่องเดี๋ยวว่ากลับมาแล้วให้ทำอะไรบ้าง
กลับมาแล้ว and speaking of the quarantine, that's what I'd like you to address too in terms of quarantine. Once you may not be staying at the hospital. Let's say you have it, but the hospital released you back to back home. Talk a little bit about that, the quarantine part.
Quarantine ก็14 days นะคะ14 days แล้วคือ14วันห้ามเราไม่ออกไปไหนอยู่แต่ในบ้านนะคะแล้วก็ถึงแม้จะมีญาติพี่น้องเข้ามาในบ้านเราต้องใส่แมสอยู่ตลอดเวลาถึงแม้เราจะเล่นกับสุนัขหรือแมวของเราเนี่ยนะคะเราก็ต้องใส่หน้ากากเพราะว่าสุนัขหรือแมวที่เราติดต่อที่เราคือเราเนี่ยเขาเนี่ยอาจจะไม่เป็นอะไรนะคะแต่ว่าเขาเนี่ยสามารถนำเชื้อที่เรามีเนี่ยติดต่อให้ญาติพี่น้องภายในบ้านได้หรือเด็กๆได้นะคะเพราะฉะนั้นถ้ากลับมาแล้วต้องอยู่14วันนะคะเพื่อจะให้ไวรัสมันออกจากกายไปทั้งหมดเลยห้ามออกไปไหนทั้งสิ้นล้างมือประจำทำความสะอาดห้องนะคะถ้าสมมุติว่าจะให้คนมาทำความสะอาดห้องเนี่ยต้องให้เขาใส่หน้ากากนะคะให้เขาใส่หน้ากากให้เขาใส่ถุงมือเวลาทำความสะอาดในห้องเรานะคะแล้วก็ล้างมือนะคะล้างมือไม่ใช่ว่าไปเอามือไปจับสบู่แล้วก็ล้างเสร็จแล้วใช้เวลา20วินาทีถ้าไม่ได้ลองทดลองดูแล้วว่า20วินาทีคือยังไงล้างมือร้องเพลงไปด้วยนะคะร้องเพลงว่า Happy Birthday 2 รอบก็20วินาทีนะคะหลังจากนั้นถ้าสมมุติว่าเราครบ14ควอรันทีน14วันแล้วเราก็สามารถที่จะออกไปข้างนอกได้แต่ว่าต้องระวังนะคะจะออกไปข้างนอกสมมติว่าไปตลาดไปอะไรกลับเข้ามาเนี่ยนะคะต้องล้างมือทันทีแล้วก็ถ้าสมมุติออกไปข้างนอกไปประชุมหรือว่าไปพบปะกับใครอยู่นานเกิน1ชั่วโมงแล้วก็อยากจะขอให้แนะนำว่ากลับมาบ้านแล้วนะคะถอดเสื้อผ้าเปลี่ยนเสื้อผ้าเลยนะคะอย่าใส่เสื้อผ้าอยู่ในบ้านนะถอดออกล้างซักแล้วก็อะไรอีกล่ะมีอะไรจะพูดอีกแล้วกัน
That's wonderful. It's a great ideas of what you said in terms of once you come back, you quarantine, and if you're sick, the major thing what Dr. Mayuvree is saying is that you've got to be vigilant in terms of wearing your mask, social distancing, wear gloves, wash your hands 20 seconds, and like she said, sing happy birthday twice. When you wash your hand, you just don't do it real quick. You go between your fingers, you go to your palm, you do really extensively washing your hands. And if you don't have let's say if you're out and you can't get near the sink, make sure you have your hand sanitizer at all time to make sure that you clean your hands and wherever you touch as well. I'd like to ask the same and let Annie, respond to that in Lao, and then perhaps Kor can also respond, add it on to in Hmong as well. Annie ตอบเลยนะคะ
ค่ะหลักการสำคัญเนาะในการปกป้องตัวของเฮาเนาะและการเบิ่งเนาะเบิ่งสุขภาพของเฮาก่อนที่เฮาจะไปทางอื่นหรือว่ากลับมาจากทางอื่นเนาะหรือว่าไปช้อปปิ้งไปที่สาธารณะต่างๆหลังจากเฮากลับมาแล้วเฮาต้องเบิ่งตัวเฮาเองว่าเฮาผิดปกติหม้องใดเฮาเป็นไข้บ่เฮาเจ็บหัวบ่เฮาเจ็บคอบ่หรือเฮาไอบ่ถ้าเฮาเบิ่งหรือว่าเฮารู้สึกว่าเฮาผิดปกติแล้วเฮาบ่แม่นไข้หรือว่าบ่แม่นไข้ธรรมดาข้าพเจ้านี้จะแนะนำเลยว่าให้ท่านไปกวดเนาะกวดโควิด -19 ในทันทีในสาธารณสุขหรือว่าถ้าท่านใดที่ว่าบ่มีบ่ฮู้ภาษาหรือว่าบ่เข้าใจหรือว่าขับรถบ่ได้เนาะเฮาก็ต้องให้ arrange ผู้ใดผู้หนึ่งพาไปหรือว่าเฮามี hotline ที่ว่า Covid-19 ท่านสามารถโทรไปได้หรือว่าโทรหาหมอประจำตัวของท่านเนาะการป้องกันหรือว่าการตรวจโควิดในสาธารณสุขหรือว่าหมอประจำตัวของท่านนั้นจะมีประสิทธิภาพและจะให้ความที่ว่าให้ความบ่ให้เฮาเข่งตึงว่าเฮาเป็นบ่หรือว่าเฮาบ่เป็นบ่บางคนก็อาจจะแบบว่าเป็นห่วงใยในครอบครัวว่ากะเจ้าเป็นบ่หรือบ่เป็นบ่อันนี้เฮาบ่อยากให้ท่าเนาะบ่อยากให้ท่าถึงว่า14มื้อบ่อยากให้ท่าถึง2มื้อถ้าท่านใดที่ว่าข้องใจว่าตัวเองเป็นหรือบ่เฮามีเนาะเฮามีฮอตไลน์เฮามีหมอเฮามีนัมเบอร์เนาะเดี๋ยวเฮาจะแจกนัมเบอร์ให้ในภายหลังแล้วก็สถานที่ตรวจทุกๆหม่องคือขน้อยไปWalmartเพิ่นก็มีสถานที่อยู่ที่ช้อปปิ้งบางหม่องบางarea อยู่มิชิแกนนี่เพิ่นก็ provide ให้ขน้อยอยากจะขอให้พ่อแม่พี่น้องนี่ถ้าท่านใดที่ว่าสงสัยว่าตัวเองเป็นและนอนบ่หลับหรือว่าเป็นห่วงว่าตัวเองอยากจะเป็นก็ขอให้ไปตรวจเนาะไปตรวจเฮาจะได้รู้โดยทันทีเลยว่าเฮาเป็นหรือบ่ต้องท่าเดี๋ยวนี้เฮามีสาธารณสุขที่ว่าไว้รองรับให้ทุกๆคนเนาะแล้วก็การป้องกันถ้าท่านเป็นการป้องกันก็ป้องกันตัวเองก่อนเนาะโดยที่ว่าเฮานี่ต้องใส่สวมหน้ากากตลอดเวลาล้างมือตลอดเวลาหรือก็เสื้อผ้าที่เฮาไปแล้วเฮาไปช้อปปิ้งมาหรือว่าเฮาอาจจะไปติดมาหรือว่าอยู่ไสก็อย่าให้ท่านทำความสะอาดแล้วก็ซักล้างหรือว่าเอาไปตากหรือว่าเฮ็ดหยังที่ว่าซักฟอกเนาะหรือว่า bleach ก็ได้ clean sanitize เนาะตัวนี้แล้วก็เป็นห่วงที่สุดก็แม่นคนที่ว่าเฮาฮักที่สุดเนาะฮักที่สุดย้อนหยังพ่อแม่ลูกพ่อเฒ่าแม่เฒ่าพ่อปู่น้าอาเนาะพวกทุกๆคนอยู่ในครอบครัวนี้เป็น number 1 ของเฮาเลยถ้าเฮาบ่มีสุขภาพที่ดีเฮาก็บ่สามารถที่จะไปเทคแคร์หรือว่าไปเบิ่งแยงเพิ่นได้หรือว่าเฮาจะบ่สามารถที่เทคแคร์ตัวเฮาเองโดยเฉพาะว่าถ้าติดเชื้อตัวนี้มาแล้วบ่อยากให้ไปแพร่กระจายเฮาต้องกักตัวเฮาต้องอยู่ในห้องถ้าว่าท่านจำเป็นที่สุดอยากออกไปห้องน้ำเฮาก็ต้องใส่แมสsanitize spray หรือว่าเฮาบ่มีเนาะในระยะนั้นเฮาบ่มีเฮาก็ต้องมีเจลล้างมือล้างมือให้สะอาดโดยที่ว่าเฮาป้องกันคนใกล้ชิดใกล้ตัวเฮาพ่อแม่พี่น้องเฮา เพราะว่าเฮาบ่อยากสูญเสียพ่อแม่พี่น้องคนที่เฮารักหลายและตัวนี้เป็นปัจจัยสำคัญที่ว่าขน้อยได้ออกมาแล้วก็มาขอร้องทุกคนเนาะถ้าท่านใดที่ว่ายังบ่ได้ไปตรวจอยากรู้ว่าตัวเองเป็นหรือบ่เป็นก็ขอร้องหลายๆว่าให้ไปตรวจหรือว่าระวังถ้าท่านไปสังสรรค์ถ้าท่านออกไปทำบุญตักบาตรหรือว่าสาธารณะเนาะอยู่ภาคหรือว่าอยู่หม้องใดที่มีเด็กน้อยหลายๆขอร้องเนาะขาน้อยก็มีลูกน้อยแล้วก็มีผู้เฒ่าอยู่บ้านก็ขอให้ร่วมมือกันเนาะทำความสะอาดใส่แมสปิดหน้าปิดตาไปช้อปปิ้งก็ขอให้ใส่แมสใส่ผ้าอนามัยหรือว่าใส่ถุงมือก็ได้เนาะถ้าท่านใดมีถ้าท่านใดบ่มีเฮาก็จะขอร้องให้เพิ่นทางอนามัยแพทย์เพิ่นก็ทางสมาคมเฮาจะพยายามจัดจ่ายให้เนาะเฮาก็มีฮัตไลน์ตัวนี้คือกันที่ซอยขอบใจ
That was me ขอบใจแอนนี่เนาะที่มา share information Kor I'd like you to say a few words about this as well
I feel like I already covered everything, but I can say about the quarantine. So yeah, so thầu ấy có món rồi nè, cái giờ chủ tàu quarantine có lâu nữa, có quarantine có lâu nữa, tại cái giờ chủ nhỏ có hóng, và ta cũng tới 2 mình gì lại, nhớ tàu có báo hay thì có tàu tụ có món rồi, ấy có chỉ báo chứng có một qua đã tự là tàu. Hỏi cho các báo hay tiêu có những một kỳ lần tư hay có những một trò lần tư là nè ấy có tàu từ mò Covid-19 nó lỡ nó chỉ lỡ mà khó quan thì có chỉ tàu nhớ hậu chế li nhớ hậu có hóng li có ý lần do cọc lót nữa thầu có nhớ ý lần cọc lót nữa tại lỡ nó chỉ có do có những tàu là mù thì mò nó tên nó là tàu đó chỉ con chọn món na long khẩn giao thiết sau mấy thứ lần tư nhớ trên tại có li trâu phi nhà thầu có là mù có lúc chỉ mà ở lúc không ná nè em mà ít lúc xứ có chỉ là những tàu ta chỉ chọn hay có giờ chủ tàu sò có giờ chủ tàu chỉ disinfected cho là mù sò tây trong tây to đời hoặc có còn đời có lửa tù chỉ xăm mó vì đó khỏi cho các món Covid-19 nó mà ít cho người dân mua hay người dân kỳ tàu là thì chỉ người chỉ mó chỉ có chỉ báo hay tiền người bỏ mó là chỉ mó họ mới ít cho người kỳ tàu người mó chỉ có thiết báo hay tiền người mó cho người kỳ tàu em người chỉ mua món đời nếu mà bằng sử dụng kỳ tàu đâu có giờ liên đạo bé thì đi xa có giờ thầu có báo hay tiền có mó lợi nó chỉ cái chủ nhỏ hậu có hóng ấy có chế năng lợi những ở rau ở mỏ đâu có no thế lợi giờ chủ take care có thế lợi chủ sai sửa có giờ thầu lúc xưa hay trong liên đạo lợi có một tá la tên nó lợi những chỉ hay tiền có mù lợi những sao có nhỏ hậu chế hậu ba hậu chế em sai sửa có tụ khen có trong lì cọc lót nút thế lợi cu mua chua đâu có no giờ thầu có mó ta hậu lợi có mua cú giờ lì ít bùa ta sau lợi có cú nó thà là nấu là mù ba tụ món đời còn nương tỷ do có nồng tên nó có cú xí tàu cho chua over the counter tên nó là một ba có họ kể nồng đời còn nương cho dù để xí khó lo ổn định có yếu nó đã chỉ có yếu chủ tàu nu có tụ doctor ổn định có nó tê giả chua đã chỉ thế chỉ ta linh ta là cú hay tiền giờ có mua chỉ có chỉ cho có báo hay có món lợi có chỉ cho mua có tay khổng bố lửa lăng lửa tù có yêu chủ kia cho khổng là người nhỏ hậu lại có mó bỏ chê nhớ thầu có mó ấy có quarantine tao cọc lót nú lại hậu có hóng có yêu chủ tao mó có tay ta chờ giờ theo mó cho mùn xùa theo mó cho mù tù rồi rong theo cái chủ so có tay trong tay to nhớ hậu có hóng bừng đỡ ấy còn nữ chỉ cho mó tay bột plan đỡ có yêu chủ kia còn nữ nhón để chờ nữ ít lưng hậu có cho bột plan đỡ đặt áp bóng là hậu tài công vụ có thi chỉ tàu trong trong họ chẳng chẳng cha bây giờ chủ tàu long ná khẩn cho lý có long tàu ấy ở trong tàu thank you Dr. Sue
Thank you, Kor. That was wonderful. Brian, I want to talk about the main thing. You and I talked about how our communities right now, what we're facing is a sense of stigma. If somebody has COVID or is sick, they feel like they're embarrassed. They're going to be shunned by the community members. They're embarrassed and things like that. So I'd like to address.
I'd like to share a story about that, about
Sure.
stigma, right? But we're in the U.S., but I want to share what it's like in the Philippines. The stigma is different, but we also have to look at it in different light. There was a situation where, again, you have to wait to quarantine yourself for 14 days is always the key. The problem was there was an individual that worked in the big city of the Philippines, in Manila. He did not wait for his result. Because he did not wait for a result, he went to his province, and 4 days later, while he was, because he missed his family, they found out he was positive. In the Philippines, in other part of the world, right? You know what they do? They shut the whole town. No one can leave the house. So talk about stigma. The stigma there was they named his family and all others. But in light of it, though, it's a little bit different here in the U.S. that we can get this from different situations. But we do need to follow certain things about quarantine. But the stigma is not to us. It's a very thing we want to talk about. So let's get right into it. It is different where it is maybe in our Asian country versus America. Right. America is very understandable, and we're here to help. So let's talk about the importance of stigma.
Wonderful, thank you. That is one of the things that I want our community members to know is that we're all in it together here. This disease, this pandemic, does not choose color, creed, communities. It's everywhere. And so I want our community leaders to share the information with our communities that, don't be embarrassed. We are here to help. We have our Thai American associations. We have the Filipino associations. We have different Asian associations that we are there to help our community members. So I'm going to ask, since I see Miss Annie already, so we'll go to the Laos and let's talk about this, Annie, and see if we can help our community members to understand that we're here for them, we're here to help, and we will provide resources as much as we can. And we do network with other Asian communities and organizations to get through this together. Go ahead, Annie.
Thank you, Dr. Su, to give me this topic. This topic is very important to me as the Laos community, to see and to hear what's going on, and especially the effect of the COVID-19. And our community here have been lost so many loved ones. And my heart has been broken, and it just after and after you hear this every time, and it happened to young kids as young as 7, and it's happened as old as 70s, 80s. These are our grandpa, grandma, these are our kids, these are our children, and you can only imagine how, if it's in fact in my family, in my own people. And this is just the tear of my heart right now, that it's just pouring out. So I just gonna go with the Laos community and talk Laos and how important it is to understand and not to be ashamed of this the virus of COVID-19 if you infected. Would you excuse me? Yeah. Gonna speak in Laos now. สบายดีพ่อแม่พี่น้องอีกเทื่อนึงเนาะขน้อยก็อยากจะมาเป็นตัวแทนให้พี่น้องชาวลาวทุกคนนะที่ว่าได้ฮู้ได้เห็นได้ฟังมาเรื่องที่ว่าการติดโควิด-19 นี่บางคนก็ว่าเป็นความที่ว่าเป็นโรคที่ว่าตัวเองอายบ่อยากเปิดเผยบ่อยากให้สังคมรังเกียจโรคนี้มันบ่แม่นโรคที่ว่า จะให้สังคมรังเกียจโลกนี้เป็นโลกที่ว่าอยากให้เฮานี่เผยแพร่ความรู้ถ้าเฮาติดมาแล้วเฮามีอาการแนวใดอยากให้แชร์พ่อแม่พี่น้องอยากให้ทุกคนได้เข้าใจกับไวรัสตัวนี้มันบ่แม่นไวรัสที่ว่าเป็นโรคที่เป็นโรคผิวหนังที่ว่ากะบ่เป็นอันนั้นบ่ขึ้นมาละคนจะมาติดมาเป็นขี้กากขี้เกลื่อนมันบ่แม่นให้เข้าใจใหม่ว่าถ้าท่านติดแล้วมันเป็นโรคที่ว่ามันไผก็ติดได้บ่แม่นมานำบ่แม่นมานำแต่เจ้ามันอาจจะติดมาจากผู้อื่นติดมาจากละอองที่ว่าปิวมาหรือว่าเฮาเดินช้อปปิ้งกันไปกันมาแล้วผ่านบังเอิญว่าผ่านอากาศที่ว่าผู้ติดเชื้อนั่นหายใจออกแล้วเฮาได้รับไปและถ้า community ของเฮาได้รับแล้วเฮาบ่ฮู้ว่าผู้นั้นใน community นั้นได้รับแล้วก็บ่แม่นความผิดของคนผู้ติดเชื้อเสมอไปเพราะว่าเฮาสามารถไปติดได้โดยที่ว่าเฮาย่างออกจากบ้านนี้เฮาก็มีความเสี่ยงแล้วที่เฮาจะติดเฮาจะไป gas station เฮาไปจับเอา something handle you gas station มันก็ติดได้แต่อยากให้ถ้าพ่อแม่พี่น้องออกมาแล้วเว้าเนาะแล้วก็มีความที่ว่าให้การศึกษาแก่ลูกแก่หลานว่าถ้าท่านเป็นแล้วท่านมีอาการแบบใดบางคนอาจจะบ่มีอาการหยังเลยก็มีแล้วก็อยากให้ทุกท่านเนาะออกมาแล้วก็ออกมาเว้ามาแชร์ประสบการณ์ก่อนที่จะสายเกินไปที่เฮาจะได้รักษาโรคนี้หรือว่าคนในครอบครัวของเฮานี่ติดกันไปแล้วก็ตายกันไปเฮาก็บ่อยากเห็นแนวนั้นเนาะอยากให้พ่อแม่พี่น้องทุกๆคนเนาะร่วมมือร่วมใจกันเพราะว่าโรคนี้มันบ่ได้ติดย้อนสัญชาติมันบ่ได้ติดย้อนผิวสีบ่ได้ติดย้อนศาสนาโรคนี้มันบ่สนใจหยังเลยมันติดได้ทุกคนทุกเชื้อชาติศาสนาและเฮาก็อยากมาร่วมมือกันอยากให้ทุกคนนี่มาร่วมมือร่วมใจกันเนาะแล้วก็รักษาอนามัยตัวเองโดยการใส่แมสใส่หน้ากากหรือว่าใส่ศพมือหรือว่าล้างมือตลอดด้วยเจลล้างมือหรือว่าล่วงน้ำหรือซบก็ดีเนาะขอบใจ thank you Dr. Su
Yes and Annie ก็บอกทุกคนไปว่า organization เนาะของไทยของลาวของมงของฟิลิปปินส์นะเฮาก็ร่วมมือกันซอยถ้าผู้ใดเป็นผู้ใดต้องการความซอยเหลือนั้นเฮาซอยได้บ่ต้องห่วงบ่ต้องย้านเฮาน่ะเปิดแปลว่าเปิดอกซอยกันเนาะคือจังแอนนี่เว้านั่นล่ะมันเป็นโรคที่ว่าบ่เลือกสัญชาติบ่เลือกคนมันเป็นไปได้นํกันหมดเนาะ
แม่นแล้วและทางเฮาก็มีองค์กรเนาะองค์กรหลายๆองค์กรที่จะซอยแล้วก็ดร.สุนี่เพิ่นก็เป็นตัวแทนผู้หนึ่งที่ว่าเฮาสามารถในมิชิแกนนี้เฮาสามารถติดต่อเพิ่นได้เนาะทางแอนนี่เองหรือว่าทางดร.สุหรือว่า Thai Association of Michigan เพิ่นก็ยินดีหรือว่า Asian Kappa เนาะ Pacific
นำอีกกับ
Mayuvree Community ก็ได้เนาะขอบใจ
นะแอนนี่now I would like to ask either Dr. Mayuvree or Ms. Nan to kind of share a little bit about the stigma or how can we help our Thai community to understand that there's nothing to be embarrassed. We are here to help each other. We are here we network, like I said, with different Asian organizations to help, the community members regardless of which Asian community members. So I'd like you to share that and, say a few words to our Thai community. นะคะ
ใช่ก่อน
แนนหรือดร.ยูรีก็ได้ค่ะ
อยากจะฝากสักนิดหนึ่งนะคะเราพูดถึงแต่ว่าการติดต่อนะคะอยากจะเสนอนิดหนึ่งว่า พวกเราเนี่ยควรจะป้องกันตัวเองด้วยการนอกจากphysical คือทางด้านร่างกายแล้วนะคะก็ขอให้ใช้วิธีการสร้างภูมิต้านทานนะคะทานอาหารที่ดีๆนะคะแล้วก็ทานพวกสมุนไพรหรือว่าดื่มน้ำมากๆแล้วก็ดื่มน้ำส้มคั้นหรือวิตามินซีมากๆนะคะเพื่อจะสร้างภูมิต้านทานเพราะว่าได้พบกับคนที่เคยเป็นโรคและเข้าโรงพยาบาลเมื่อวานนี้ก็เจอกับเขานะคะเขาเข้าโรงพยาบาล15 วันนะคะเขาถามแล้วก็ถามเขาว่าเป็นไงบ้างเขาบอกว่าเกือบไม่รอดเนี่ยเพราะว่ามันแย่มากค่ะเขาก็บอกว่าเขาได้ทานพวกสมุนไพรดร.สุกับคุณไรอันเนี่ยรู้I think Ryan and Dr. Su know about this one so anyway เขาทานสมุนไพรนะคะแล้วก็คือเขาทานแล้วหมอบอกว่าไม่ให้ทานนะกลัวจะเขาเป็น diabetes เขาเป็นเบาหวานเขาบอกว่าหมอลองทานดูสิไม่มีน้ำตาเลยหมอก็บอกโอเคลองทานดูพอหมอลองทานดูก็โอเคอยู่ทานต่อไปได้เขาก็ทานเขาบอกว่าเขาทานแล้วเขามีแรงที่จะสู้กับไอ้โควิดไอ้ไวรัสตัวเนี้ยเขาบอกว่า 3-4 วันแรกเขามีอาการแย่มากเขาก็เพิ่มสมุนไพรตัวนี้เป็น3 แพ็คต่อวันเขาสามารถที่จะใช้กำลังกายกำลังจิตใจของเขาเนี่ยต่อสู้ไวรัสแล้วเขาก็discharge ออกมาแล้วเมื่อวานนี้เจอเขาก็ดูท่าทางแข็งแรงดีแล้วก็เขาก็ขอบใจพวกเราที่ว่าได้เสนอแนะนำเขาให้ใช้ให้สร้างภูมิต้านทานของตัวเองเพราะฉะนั้นอยากให้พวกเราชาวไทยนะคะทานอาหารเยอะที่ดีๆทานผักเยอะๆนะคะสร้างภูมิต้านทานถ้าเรามีแรงมากๆเนี่ยเราจะสามารถต่อสู้อันนี้ได้อย่างดีนะคะก็ให้คุณแนนพูดต่อในเรื่องของความช่วยเหลือของสมาคมที่จะมีต่อพวกเรานะคะว่ามีอะไรบ้างขอเชิญค่ะ
ค่ะขอบคุณค่ะดร.มยุรีก็อย่างที่ดร.มยุรีบอกนะคะนอกจากจะทานอาหารที่ดีพักผ่อนให้เพียงพอแล้วก็ออกกำลังกายนะคะแล้วจิตใจก็เป็นเรื่องที่สำคัญบางคนก็จิตใจกระเจิงstress เครียดใช่ไหมคะโน่นนี่ไปไหนมาไหนไม่ได้อะไรเงี้ยบางทีเราก็ต้องนั่งสมาธิบ้างนะคะเพื่อให้จิตใจเราสบายขึ้นเมื่อจิตใจสบายขึ้นก็ทำให้ร่างกายแข็งแรงขึ้นนะคะเสร็จแล้วทีนี้ก็เรื่องการช่วยเหลือถ้าเกิดว่าบอกว่าคือถ้าใครเป็นแล้วนี่ไม่ต้องอายนะคะไม่ต้องอายให้โทรติดต่อมาถ้าเกิดว่าไปพบแพทย์ไม่ได้หรือว่าไม่รู้จะไปติดต่อใครยังไงไม่มีใครเนี่ยโทรติดต่อเข้ามาดร.สุดร.มายุรีหรือตัวเนนเองนะคะเราจะช่วยเหลือติดต่อนำท่านไปส่งที่โรงพยาบาลหรือไปหาคุณหมอนะคะอาจจะเป็นคุณหมอไทยหรือคุณหมอฝรั่งอะไรอย่างนั้นนะคะที่ไหนใกล้บ้านหรือว่าถ้าใครสงสัยว่าตัวเองจะเป็นก็เดี๋ยวนี้เขามีตรวจหลายๆที่นะคะที่ไม่ต้องเสียสตังค์นะคะแล้วไปเช็คได้นะคะไม่ใช้เวลานานเหมือนแต่ก่อนเสร็จแล้วทีนี้ก็ถ้าเกิดว่าใครต้องการอยากได้หน้ากากนะคะหรือว่าเฟสเชียลหรืออะไรเงี้ยเราก็มีแจกให้นะคะเรามีหน้ากากที่ทางสถานกงสุลได้ส่งมาช่วยเหลือเราก็ยังพอมีเหลืออยู่ถ้าเกิดว่าใครสนใจอยากจะรับก็เชิญติดต่อเข้ามารับได้เลยทาง Facebook ทาง Messenger หรือว่าถ้ารู้จักเบอร์โทรศัพท์ก็โทรกลับมาได้นะคะแล้วก็ส่วนวิตามินที่ใครสนใจว่าเป็นอะไรก็ติดต่อดร.มยุรีติดต่อแนนเข้ามาได้นะคะเราจะบอกให้ได้ว่าอันนั้นคืออะไรนะคะก็หวังว่าทุกคนจะดูแลสุขภาพตัวเองให้ดีแล้วก็ไม่ต้องเครียดนะคะ
Thank you, Pinan. I just wanted to share and also a little bit of what Dr. Mayuvree was saying. She was just sharing personal experience of someone she met who went to the hospital. And, the whole idea is to build immunity, and take good care of yourself so that way you're healthy and you can fight, this COVID, by taking good care of yourself. And anything else that Dr. Mayuvree is saying is part of what somebody told her in terms of what they took vitamin C, they may have take some kind of herbal and things like that. So that's more of an individual experience. I don't want our audience to think that we are trying to say that we know that we're experts in certain things, whether it's herbals and things. That's not our goal here. Our goal is just to share what the person's experience was like in terms of building his or her immunity. So I just want to put that out there so the audience doesn't feel that we are trying to be an expert in something, which we're not doing. Thank you.
Well, ladies, thank you for summarizing that. And from what I'm gathering, Dr. Sue, is the fact that stigma is just a stigma, but that can be beaten through education and through science. That it should not, because everyone gets affected. Anybody can get it. But again, it's the key thing that we talked about today, why it's been impacted. We need to take the proper precautions for our community. For example, like you said, probably part of it is understand that you can't have big parties or big get-togethers without the proper precaution. Maybe forget about the birthday parties or family gatherings for this year, right? We cannot take that risk because that's how people get infected. And in fact, when they come home and meet the rest of their family who are maybe elderly, who are young, who are sick, and when there's close quarters, it's a lot more difficult to prevent the disease. And that's why they do say all the discussion that we had earlier today, social distancing, not to be too crowded in places and all that. And to me, that's not a stigma. That's just the right thing to do, so you don't get infected by this pandemic disease. So I'd like to bring all the ladies, the panelists, on screen, and I want to kind of ask maybe some questions, and we have to do it in English this time around and share your thoughts, right? So we'll start with Nan. Nan, I have a question for you. As a leader of the Thai community, American community, is that you have it's a big responsibility to make sure that your members and the people that you know are taking notes and importance of this. What else can you, as the Thai American president right now, if you were to say to us, give me two important things that in your thoughts that can help stop spread disease. And we're going to do it in English this time around for our English because of where the leaders of in your expertise. Please share us with that now.
So, what can I say?
Well, I think part of it is stuff that we talked about earlier too, that you stated in your thing is how do you advise your community? Maybe they're a little stubborn. They don't, what would you think of doing or saying to them? Like maybe a certain thing, because in a lot of places it seems like we have people that don't listen, right? So what is a diplomatic way to say something to your community that will maybe they'll listen a little bit better? What can you say?
The first thing,
maybe a
if
story.
you face to face, you have to wear mask. When you know you're sick, do not get out from the house. You keep yourself to be everyone else is safe, your family, and
We appreciate that. Is very important.
And the important thing, Ryan, is that what you don't know about Ms. Nan is that she's very eloquent when speaking Thai, communicating to her members. Because I listen to her. She is telling you kind of direct, straightforward. But when she speaks to the community, her words are very, very eloquent. I always turn to her and say, "That's what I'm trying to say," but I just didn't say it in a nice way. I just
And
wanted to, yeah,
and
say
I appreciate those are still very important things that for our English listeners to say those important things you just stated. It's very simple, but it's very important, right? Okay. Now I would like May to say like what would being where you're at in history, being also with the Thai community and then vice president. Aside from the mask and social distancing, what else can how would you handle situation where you know we're not I'm not going to get it because I don't believe my friends have it or things like that, especially in our community. We're stubborn, right? Asians are very stubborn in our community. How would you diplomatically handle that conversation and say maybe in English for our English listeners?
Okay. Just want to tell everyone that we are all together to fight this virus, the virus that none of any medicine beside the vaccine can help us. Please take care of yourself. And if you are sick, let someone know. And so we can stop the spread of the COVID. And I want to let you know that I love everyone. Please take care, stay safe, and we are together. Let's fight. Thank you.
Thank you, Ray. And Kor, my question is to you too, being in the Hmong community, same thing, a lot of very tight quarters in some of the homes. So maybe like in the Filipino community, we might have 6 to 7 or two families living in the same household. And share, what would you want to say to that family or that group? Like, hey, you know what? Maybe I shouldn't go to that. How do I stop spreading it in my own household? What would you say to that family?
Okay, so nhớ trong bây giờ này thì mong đùa quyến bó hay tiề dù trên dân chừng trắng thế bây giờ mà chỉ dấu thế bây mà không nhớ ok họ ý và ý chế bây mà mình tự mình nhớ trong chưa sáng giờ có chế nên bây giờ chủ sáng sửa bé chế nên có dòng lý thao thi dòng tàu và bé sắc kỳ tụ cá mò Covid-19 nó vì đó khó hay tiề bây tôi nhớ ok bé xí xin giờ thế bé xí lô bé xả tôi xí bỏ thì bé chín cho cá hay tiề itu kamonan yo ito pesha da beto nya oke te shikuyin po te ben jo ilang itu nya thau kan jo ilang itu là hu phòng một trò lại xứ and then thế có tôi bỏ là nhỏ lên da tàu phi da thia cái yo chủ trong cho mes tàu lấy long na khẩn cho lúc hở có nhỏ dền ra ilang itu da nó ya kho chẳng bị tụ cam Covid nó nhưng chỉ sai tụ lầu tụ lùa lấy tụ lần tư là dân thầu trâu co lại chị dân trâu xòa từ nhà học co lúa ba lúa trên đó.
Okay, translation, please.
I can say I say thank you to all the Hmong community in this area. I know that the family is very important, and we have a big family in each individually, and we know that they love each other, and we know that we want to see one another. But safety is always very important for one another. So we have to protect your own family, which is you can make a phone call if you miss somebody, or I did not mention in Hmong, but now we have new technology. You can do FaceTime or Zoom. This is all like something that you can contact with your family, that you don't have to come in and stay together in one household with more than 10 people. Then once someone affected because the virus, who or anyone can have the virus, doesn't have the symptoms, and they can spread the virus. So once somebody get it, you will feel sorry for it, but there's nothing you can do because your loved one already sick. Maybe the whole house could be sick because of one person can spread all this. And very important that we keep distance and keep masks, and then maintain hygiene with hand washing. That's very important. And then we have to keep our community unity to maintain what's the government was saying, the mask, distance. We have to follow all the direction, the guidelines. This is one of the best distance that we can prevent, because per my experience, I work in the hospital, I see this every day, and then we maintain those. We wear masks, we wear goggles, we wear gloves, we hand sanitizer constantly. And if you pass it out about all the protection or the gear that they call the PPE, of course, you concern and you worry about it, but then you will protect yourself. If you maintain all this, you will be distant and you will not get the virus easily. I mean, I did not say this part in English, but I added more into like what my work experience.
Yeah, awesome. Thank you.
Thank you.
And Annie, I'm gonna. This is your time to same thing. A plea to your community in your language, and then summarize it for us. Please share your thoughts and your pleas to help stop the spread of this virus.
Yes, thank you, Ryan. One more time. Um, you asked for two kind. It was so many things that's over my head right now.
We'll keep it
As
at
a
two.
mother, as a mother, as a cooker, home cooking, and with the community work, and also as myself and my community know who I am, I really ongoing with the public, hand on, and every weekend we will have gathering, big gathering. You talking over 500 people. I've been there many times. Weddings, retirement, graduation, birthday, you name it, we there. We doesn't miss any party because we are dedicated for our community. But it's now how we gonna do that. We have to start with ourselves. We have to start stand up and say, hey, we have to stop everything. No party, no drinking, no graduation party. As my son, he graduated in 2020. We stopped that. No, nothing. As I have 6 and 7 years old kids, and I'm already decided not to take my kids to school this year. I talked to my husband and said, look, I'm rather have a dumb kid than see a kid in the ventilation. That's really breaking my heart. So now I want to start with myself and want to spread all this care and loving by how example in our family. We have to start in ourselves, how we want to other to see, set our example. If as a community we see the party, then I want to go party too. It's not fair, right? So I'm gonna do my party. So we have to cut that out cold turkey. Everything we do, cold turkey. I don't smoke. I drink occasionally, but I know how hard it is to go see the loved one. It's just like addiction. It's just like a endorphin in my heart, but I can't have it. It's just like addiction of something, but it's not addiction of a good a drug or anything. It's the addiction of how you caring, and you want that. You want that energy. You want that in your life to move on. But without your health, you wouldn't have any of this. You wouldn't have your family. You wouldn't see anyone. Nothing. No one. So please, 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 I urging all the community to stick together and be apart for a while. Stay in your own comfort zone, your home everywhere. But in a matter, if you need to go shopping, just like I'm a mom, I use Instacart. I never use it online. I use it now. I go, they have everything. I name it. I would recommend all the moms out there to use Instacart. You don't need to go hustle in line anymore or waiting outside anymore or risking your health for your loved one anymore for just for now until they have any vaccine coming out. But if they have a vaccine, we don't know if the vaccine is good for the rest of our life, like polio shot, or it
Yeah.
just come and go. If we get infected, we have to get a shot like a flu shot. We don't know. So
Yeah.
we don't want our loved one to risk a life. We don't want us to be the one to be a victim of this virus. So I
Great.
urge all the parents, out there, or the teenager, just like my son. Mom, I need to go get taco.
Yeah.
Please,
And
taco, we can make it at home. I use Instacart to
yeah,
get taco, you know. But a
yeah,
lot of time, teenagers are very curious at 7 and 6 years old also. They want to go dollar store with us. They want to do things with us. But
yeah.
please,
It,
please, please, I really urging all of you for take care of yourself. And if you catch it, don't spread it. If you spread it, you know, it could
you got
cause life. Yes.
well, Annie. Thank you so much. I
Thank
appreciate it.
you.
Your plea. And Dr. Sue,
Yes.
I like you to share your thoughts on our with our panelists tonight, and then we'll have the final word. And thank everyone. So, Dr. Sue,
Well,
please.
I want to thank you, Ryan, for giving us this opportunity to come and share information and also to share our hearts with our communities. The main thing is that I want our community to know that we are in this together, meaning that we are here to support, to help, each other. If you are, for example, you need to call because you may be feeling sick or whatever from, the symptoms and you don't know, and you call the hotline and they don't speak the language, whether it's Hmong, Lao, or Thai, reach out to us. We can provide that. Even I have community members from other communities such as Indian community or even any other communities. My thing is that if you reach out to us, meaning our organizations, and to me, I won't turn you away. I will find resources. I will find a way. I may not have all the answers, but you know what? I'm going to ask. The first person I ask is Ryan. I always say, Ryan, do you have this? Do you know this? And Ryan has always come through. So my thing to to say to our communities is that we're in it together, and I am here to help to provide resources as much as I can. And same with Miss Nan, and Dr. Mayuvree, and I know Kor is also very active in her community, and same with Annie. So we're here.
Well, thank you, ladies. First of all, I want to I really deep appreciation for all of you joining us tonight. Nan, Mary, for Annie, Dr. Sue. To summarize tonight, it's amazing that we have 5 wonderful ladies that care about their community so much. Without their heart and passion and belief in we can beat this disease by following simple steps and forget the stigma, we can beat this disease together in our community. Because at the end of the day, we can party all you want, you miss all your friends all you want, but if you're sick and you die, there won't be a future party to enjoy. With that in mind, that I would not, anyone who wants to reach us after the show, you can just email us, or you can also face us or chat with us. We will direct you to these wonderful ladies of all their organizations that they lead. Again, ladies, without a doubt, you are wonderful, wonderful advocates of your community. And tonight, your heart and your passion shows in this show how you care about your community. And with that, all the community, especially the Thai, Laos, and Hmong community, we thank you. And thank you.
Thank you, Ryan.
Thank you.
Bye,
Thank
everybody.
you.
Thank
Thank you.
You.